All right, welcome. It's Taylor time. September is Ovarian Cancer Awareness Month. And joining me now to talk about personalized medicine for ovarian cancer patients is cancer survivor Jan Amato and Hillary THEAKSTON, the executive director of the Clearity Foundation. Welcome to Primetime, ladies.
Thanks so much.
Thank you. First of all, congratulations. You are a survivor of the silent killer.
Thank you.
And as I was telling Jen earlier, is that it's the one cancer, I mean, all cancer, you know, is scary and it's horrible, but ovarian cancer has no symptoms. That's why they call it the silent killer. Did you mind, first of all, telling us about your experience to kind of give us a personalized
Sure.
approach?
I was first diagnosed when I was 47 years old in 2001. And again, it was silent. I was on vacation, and overnight, I just swelled up and had to go to the emergency room, and they flew me back to San Diego, and within 2 days, I had surgery, and they removed a 12.5-pound tumor out of me that was
12.5 pounds
swelling by the day.
Okay, so were you regular about getting, you know, your annual
I had just had a cleared
smears?
physical in June, and this was July 2nd that I had the
So
surgery.
in 1 month, you had a cancer tumor that grew to be, did you say 12 pounds?
12 pounds, it was filling up with
That's bigger
fluid.
than a baby.
Truly. Truly.
And so they say to watch out for
Swelling.
your girth and swelling, edema. Did you experience edema anywhere else?
No, it was just honestly, it was
just because you had a 12-pound tumor baby.
Yeah.
That's so sad.
It was really sobering. And I was deemed surgically cured at that time. And I went 7.5 years before I had recurrence. And that enters the story of how I got involved with the Clearity Foundation.
But I have to tell you, folks, that some women aren't as blessed as you. Because
that is the truth.
I mean, the fact that you had that it grew so fast and showing was so big that they could see it. But some women don't have that experience, and then it's too late.
It was sudden, and I was lucky that it was diagnosed as stage 1A, and so I was able to, you know, survive. And then 7.5 years later, I had recurrence, which is common with ovarian cancer patients. Unfortunately, very sobering. And so I got on the standard treatment, and it worked for about 1.5 years, and then it occurred again. So in the third battle, I was under chemotherapy that didn't work, and my doctor finally scratched her head and said, "I have nothing for you." I was referred to the University of California, the Moores Cancer Center, and I couldn't qualify for any of the trials because I'd had radiation. So they looked at me and said, "We have nothing for you," and that's when we turned to the Clearity Foundation. And through their efforts, they found a drug that is typically not prescribed for ovarian cancer patients. It's usually reserved for lung cancer and mesothelioma patients, but it worked within 3 treatments.
What a blessing.
It was a miracle. I would not be here talking to you if it wasn't for the Clearity Foundation and their work.
Oh my, and do you have children too?
I have one daughter. She's applying to medical school, and I did get to see her graduate. It was very important to me, and I owe these people my life.
You sure do. Wow. Let me ask you about the disease real quick. It really is a disease. They say that middle-aged women are affected,
in large part, yeah,
or postmenopausal. I don't really understand that much about that.
Yeah, most women are postmenopausal who are diagnosed with ovarian cancer, but we're starting to see younger women who are
Were you
diagnosed.
postmenopausal when you were diagnosed?
I was kind of going through the perimenopausal phase, yes.
Interesting. Okay, so tell us your relation with the Clearity Foundation and Hillary.
Well, I actually had read an article, a very small article that appeared in Oprah magazine, and that's how I became aware of Dr. Laura Shawver, who is the founder of the Clearity Foundation, and she ended up, she was a researcher and ended up getting ovarian cancer herself. And so her passion then was like, she was startled to find that we're dealing with ovarian cancer the same as we did 40 years ago. And so she brought her knowledge of researching techniques, which really impressed me. And I thought, I've got to meet this woman, and I'm kind of lucky I did.
Oh, and then it's all about paying it forward now.
Paying it forward.
Counting your blessings.
It is my mission.
Tell us about the foundation, and you have a big event coming up.
Yeah, absolutely. So the Clearity Foundation, we're dedicated to helping women like Jan who have recurrent ovarian cancer. 75% of women are diagnosed in late stage, as you pointed out, and for them, most of the time their cancer comes back. And as Jan said, in today, even today, we're treating recurrent ovarian cancer much like we did 40 years ago. So we're trying different drugs to see if they work. And if they don't, most women just sort of run out of time. So what the Clearity Foundation does is that rather than trying these drugs in a trial and error manner, we actually take a sample of the tumor. So we got a sample of Jan's tumor. We work with diagnostic laboratories to test it, and that allowed us to identify some drug treatment options that might, as Jan said, these aren't drugs that are not approved for ovarian cancer. They're approved for other cancers, so they might not have been tried. But the way that Jan's tumor was behaving was more like a lung cancer tumor. So a drug that was approved for lung cancer was a better choice for her, and it ended up working. So what we can do is, on the basis of how the tumor is behaving, select drugs that are more likely to work and deprioritize those drugs that are less likely to work. So that's how we're helping women choose between all of these different options rather than in kind of a random trial and error method.
I love it. So innovative and how smart. So you're not poisoning the woman's body with the radiation chemotherapy and all the other medications that have horrible adverse effects, right? So brilliant.
So Jan was prior to this mesothelioma and lung cancer drug, she was treated with a drug that was approved for ovarian cancer. It just didn't work. And so that was a really brutal treatment, difficult side effects, and she didn't get any therapeutic benefit for it.
6 months.
Yeah,
6 months of, I had to have blood transfusions, I was hospitalized, it was a rough 6 months. And so to be able to, instead of just saying, okay, well, here's the next one on the list we can try, to have one that's really tailored to your tumor can save women, in my opinion, a lot of anguish and a lot of toxicity, and give them a better quality of life sooner.
They should generalize this into all cancers.
You're exactly right. And this is where it's going. This is where the field is going. It's already standard of care for breast cancer. We're already doing this for colon cancer, for lung cancer, for skin cancer. What we're doing is we're figuring out how these tumors are behaving at a molecular level. And you know, in an environment, the type of biotech and life science innovation hub that we live in here in San Diego, it's really shocking for people to read about these technical advancements in the newspaper, and then when they get diagnosed and they go in to see their doctor and they say, well, are we going to test my tumor? Are we going to sequence my tumor? And they hear, no, we're going to just try different drugs that will be difficult to tolerate, and we're going to hope that one works. And as Jan pointed out, when our founder, Laura Shaver, who is a scientist, she was an oncology drug developer, when she found out that this was standard of care for treating the cancer that she'd just been diagnosed with, she said, this is unacceptable. I know that we can do better. The technology exists today.
There is a reason.
Exactly. It's being applied in other cancers, and there's no reason why we can't apply it in ovarian cancer. It's difficult. Ovarian cancer is really complicated. It's very complex, and you have to do a lot more testing than you do with other cancers. But we invested the time and the resources, and we have that capability to help patients who are battling the disease today.
That's awesome. What a miracle. Huge advancement. So many women you can save, huh? Let's talk about this event that's obviously going to raise money for all this research and helping women, right?
Yes,
When is it?
So it's October 27th. It's called Wheel to Survive. It's being hosted.
I love that.
Yep. It was actually conceived by one of our patients who's in Dallas. And so she hosted the first event, and it was tremendously successful. And she's helping us to host it here in San Diego and in the Bay Area. So we have 2 events within a week of each other. The one in San Diego is on October 27th. It's being hosted at the Sporting Club at the Aventine in UTC. It's a gorgeous facility. Just
it is.
Terrific. They've got a lovely spa there. The spa is offering a discount for people who register for the ride, a 25% discount. We're expecting 100 riders of all skill levels, from experienced riders to complete novices. It's going to be a really inspiring event. We have a lot of patients and survivors who are turning out to support the event. So it's
what is your goal? How much money are you hoping to raise? Let's pull up their website so you can get involved and partake yourself.
Terrific. It's ClearityFoundation.org. The registration links are right there on the homepage. We're hoping to raise $100,000, and We'd love to
Bam.
have you come out, Taylor,
I
and join
would
us.
like that. If it's not during soccer Saturday, I told you I have 4 daughters. That's what I do on my Saturdays.
Bring them along.
I know,
It's,
they
family
would,
is welcome.
I would like
We've had
that. I
great-
would like that a
Yeah,
lot.
we'd
And
love to
anything we
have
can
you.
do. You know that UT is committed to raising $1 million for cancer research
That's
this year.
terrific.
So it's pretty amazing.
great.
We would like to get more involved,
Yeah.
and in October maybe circle back with us, and we'll get the word out even more.
For sure.
Sound
that
good?
would be great. Would love it.
I
Appreciate
love
your
this.
support.
Thank you.
Yeah, thank you. Thanks.
Yay! Sky's the limit now.
Sure